everyone. It's time for Tuesdays with Tina. It is Tuesday, January 24th, and today we're talking about automated delivery devices and blood pressure review. So we'll let everybody come on and just take a moment and get everyone in. Hello, Instagram. Happy to see Instagram up there. And hello, Facebook friends. Hello down here. Hope you're doing well. Okay, let's see. Got some pop-ups coming on. And Facebook friends, feel free to throw it in the comments. And Instagram friends, happy to see you. Throw in some comments. So, as I said, today we're going to be talking a little bit about automated delivery devices and also with some blood pressure guidelines. And Kelsey, thanks for asking to be a part of my live. But if that's something you want to do, let's talk offline and maybe we can coordinate something to get together, okay? So anyway, it's really important for us to be thinking about these things. And if you saw my post that I did yesterday about a reminder of looking at the oral pharyngeal area, tonsils, and the tongue, and how these can be indicators of sleep apnea, so can blood pressure, right? And actually, blood pressure is a great indicator for several different conditions that we can see in the human body. And it is actually one of the highest indicators and risk factors associated with stroke, right? There's several different factors that are associated with stroke, but blood pressure is one of the bigger ones that it's around. And for those of you that were able to join in on the medical emergencies review that I did last week, you know, you got to hear me talk about it. And if you missed out, that's okay. We'll talk about it here. So you can save this and share this with your friends and such. But some things to remember is that, you know, I know we often think that we only want to do blood pressure screening when we're doing anesthesia, right? And, you know, and I used to think that way. I did. I was like, oh, you know, I'm not doing any anesthesia today. It's okay. I don't need to worry about it because, you know, what's the risk, right? But as my 20 plus years of being a hygienist and going in and becoming an educator, if you ever want to be humbled, become an educator. I'll tell you that. Like, you forget how much you learned and how much you don't know and how much you have to relearn again. That, you know, reviewing and learning all about the importance of blood pressure, it's like, wow, there's a lot that we can do as oral health care professionals to help our patients with that. Now, I'm not saying that we're in the business of diagnosing blood pressure, but we can actually, you know, be an advocate. We can help our patients with that, right? So as a reminder, you know, when we're doing blood pressure, you know, it's always great. The best method is going to be the standard, you know, blood pressure cuff and the stethoscope using the sphygmometer. Isn't that such a sphygmanometer? I actually looked it up and I was saying it and spelling it wrong all these years. We want to use that. But if you have a wrist cuff, that's totally okay. When I was going through and I was reading this up on the American Heart Association, there were some really good reminders about how to take blood pressure that I hadn't been thinking about. One of them is our patients not talking, and I think we know that, right? We've heard that before, and not having our patients' legs crossed, that can also elevate their blood pressure. But, like, us as clinicians, we shouldn't be talking either, right? Like when we're doing the wrist cuffs or the automated brachial cuffs, sometimes we'll sit there and talk with our patients, right? Because that awkward silence, that can actually elevate our patient's blood pressure. But so can a full bladder. So if your patients, you know, you bring your patients back, you know, say, hey, now's a good time to use the restroom. Then you don't have to worry about them, you know, like, sit right in the middle of your appointment saying, I got to go potty. But, you know, that will actually also help with reducing their blood pressure as well if they don't have a full bladder. And I didn't think about that. Like, a very full bladder can make your blood pressure go up. And, I mean, I guess I get it. Like, when I really have to go potty, it stresses me out. And so my blood pressure does feel like it gets a little high. I don't know. Anybody else ever have that experience? So while we're doing that, again, it's not just for anesthesia. We want to use it as another additional screening tool because it can help us identify our patients who might be at risk for sleep apnea when we combine that with the other cofactors that we can see orally. It can act as a nice screening measure for our patients who might be at risk for stroke or other cardiac disease, you know, to say, hey, Now is a good time to connect up with your primary care physician, especially as so many people don't go and visit their primary care physician either. So just a little review and reminder on that. If you were curious what a normal reading is, I always have to go back and look at my little chart that I've made to help me. A normal reading is 120 over 80 or less. And then elevated is actually in the 120 to 129 over 80 or more. And then, or in that 80 zone. And then hypertension stage 1 is 130 to 139 over 80 to 89. And then hypertension stage 2 is 140 over 90. And then, like, good golly, they have to go, like, now, no waiting around, is if they are 180 over 120 or anything like that or higher. So just good to know. All right. So any questions or thoughts or comments about blood pressure, please feel free to throw it in there. But we're going to go ahead and sway over now to the automated delivery, anesthesia delivery devices. Now, sometimes we know these as computer-aided delivery devices, computer-led anesthetic delivery devices. There's a lot of different ones out on the model, and this was actually out on the market. This is actually what somebody from last week's live asked if I would touch on these. And so I was like absolutely happy to. Now, I will say, pure transparency, I've only used one type of computer-aided delivery device, and that's the DentaPen. I've only ever used that particular version. And it's it's very small. It's like, it probably weighs maybe 1 pound, and it's, about this big, and then it has the needle portion which extends out, and very, very simple and easy to use. You can go anywhere in the mouth and you can do any injection. The nice thing about any of the computer-aided delivery devices is that you get a very slow, steady, consistent flow. So, there's none of this, are you going too fast? And one of the biggest risk factors for causing an anesthetic overdose for our patients is, 1, injecting into a blood vessel, and 2, depositing the anesthetic way too fast. So if you're using a computer-aided device that helps you administer the anesthetic in a very slow and controlled manner, which can also help with our patients' discomfort of receiving anesthesia. So that's one of the benefits of it. The other thing is that because it has this very consistent pressure, that it can be more comfortable for our patients, especially like the paddle injections can tend to be a little bit more comfortable with those particular ones. And it's, no clinician fatigue, because you're just holding. And, there's other ones that are kind of like the wand, or where you have a very long, skinny handle to hold on to that you can use. Makes it a lot easier for you as a clinician as well. The drawbacks can be, the cost associated, but also it can be kind of noisy. Like, there's some sounds associated with it. So especially like with the DentaPen, it's battery operated, and so you're gonna hear the machinery working. So those can be some of the downsides to it. But I think some of those upsides are kind of on par or equal too. So curious of your thoughts. If you've ever used any of the computer-aided delivery devices, I'd like to hear your comments, whether you're watching this live right now or the recording or not. So all right, friends, that's the wrap up. We're gonna keep it short and sweet tonight, and I hope that works for you. If you're just joined in, you're going to have to rewind and watch it again so you can see what we talked about regarding blood pressure and the computer-aided devices. I would love to hear your thoughts and comments on it. And with that, I always like to leave you with the little quote of the week, which was actually is, if you want more joy in your life, I can't remember the quote right off my head now, but basically, if you want more joy in your life, think good, do good, and keep doing good. And the more good you look for, the more good that you do, the more joy you're going to have. So go do good, go be good, and thank you all for joining and sharing this with your friends, and I'll see you guys next week, okay? Cheers, bye.